name's Dr. Chancellor, and I'm one of the neurosurgeons of New Jersey. I work at Valley Hospital and St. Joseph's in Paterson, as well as St. Barnabas Medical Center and Mountainside. The recovery time following treatment of a brain aneurysm depends a lot on whether the brain aneurysm is acutely ruptured, meaning there's bleeding in the brain, or whether the aneurysm has never ruptured and the surgery is preventative. So in the case of rupture, patients tend to be sick and in the hospital, and the recovery time is inside the hospital, where we have to watch patients very carefully after we've closed the aneurysm by inserting small coils inside the dome so that it can no longer bleed. So the recovery time, if the aneurysm has bled, is longer and on the order of weeks, to ensure that other issues, consequences of having the bleeding in the brain, do not cause permanent harm to the patient. On the converse, there's aneurysms that have never bled and are just discovered. Either you have a headache and you may have an MRI of your brain, or you know other family members have aneurysms and that's the reason you may have had a scan of your brain that revealed an aneurysm. For those situations, prophylactic or preventative treatment of aneurysms, the recovery time tends to be quite short. Most of my patients would come to the hospital, have their procedure, and we observe after treatment with coiling or flow diversion or a combination of techniques suited to the specific aneurysm that we're treating. And then I observe the patient for at least 1 to 2 nights in the hospital as they recover. And after that, the patient's able to go home and typically feels well. The reason that the recovery time is so low is because these procedures are minimally invasive and performed through catheters. The catheters are inserted in the blood vessels. We take them up into the brain using cameras called fluoroscopy, which are like CAT scans, but it does not involve opening the skull. And so that's why recovery from preventative treatment of aneurysms can be a few days in the hospital, and at home you feel well typically afterward.